For a long time, stomach ulcers were treated as a stress problem, with doctors assuming anxiety, diet, or lifestyle were responsible and focusing treatment on reducing acid and managing discomfort, rather than questioning what was actually causing the condition. As long as patients felt some relief, that explanation stayed in place, and there wasn't much pressure to look deeper or change the approach. Barry Marshall was one of the few who didn't find that satisfying. While working with stomach biopsies in the late 1970s, he began noticing bacteria in samples taken from ulcer patients, which stood out immediately because the stomach was widely believed to be too acidic for bacteria to survive at all. Most researchers brushed this off, usually calling it contamination, partly because that explanation was convenient, and partly because it didn't require rethinking years of accepted treatment. Marshall kept seeing the same thing, though, with the same organisms appearing again and again, and the symptoms lining up too closely to feel accidental, which made it difficult for him to dismiss what was in front of him. Together with a colleague, he suggested that ulcers weren't caused by stress at all, but by a bacterial infection, an idea that didn't go very far because accepting it would have meant changing how ulcers were understood and treated. Rather than continuing to argue a point that wasn't gaining traction, Marshall decided to test the idea directly by drinking a solution containing the bacteria himself, fully aware that if nothing happened, the theory would collapse immediately. Within days, his stomach became inflamed. Tests confirmed infection, and once antibiotics were introduced, the symptoms cleared without any other changes to his routine. As other patients were treated the same way, their ulcers cleared as well. Long-term medication became unnecessary, and relapses that had once been common started to fade. Over time, treatment protocols shifted. Antibiotics replaced lifelong symptom management, hospital stays shortened, and ulcers stopped returning in the same patients year after year. By the time the broader medical consensus caught up, the practical work had already been done, and Marshall simply went back to practicing medicine.